PVS, after COVID vaccine has been reported but has yet to be well characterised. But we're characterising it now, post-vaccine syndrome. So chronic syndrome with symptoms that began soon after vaccination is how they are defining this, which makes perfect sense. That's a very logical way to describe this. Now, the method they used, and this is people who joined the study, May 2022 to July 2023, 241 individuals reported, which is quite a good number for this sort of semi-qualitative study describing the number of the type of symptoms that people are suffering from, mostly from the United States. Now, I will be putting a link at the end of this. I think it looks like you can join this from anywhere in the world, so that's in the description underneath. But we'll mention that in a minute. Patients 18 years and older who self-reported post-vaccine syndrome after COVID vaccination, and they also did deep immune profiling is used for some individuals. So some people, they just listened to their symptoms, and others they did deep immune profiling. So looking at the white blood cells, the different types of white blood cells, the chemicals given off by these white blood cells, a thorough analysis of the blood cells responsible for immunity. So there was this biological aspect as well. Now, the results, median age was 46 among participants with post-vaccine syndrome. 55% had received the Pfizer, 86% had received the Moderna. They're the only ones that are mentioned. Johnson & Johnson was given for a time in the States, of course, as well. Pfizer mostly, but Moderna also. Now, time from index vaccination, first vaccine, to symptom onset. Median time was 3 days, but it varied, interquartile range, that's 50% of the participants who responded was between 1 and 8 days. But the thing is, some of these features seem to go on for an awful long time. Now, when this line of treatment first came out, it was very hard to conceptualise that there would be such potential long-term issues. That's really been quite a surprise and a major disappointment. In fact, it's quite concerning, really, as many of you sadly know from personal experience. Time from vaccination to symptom survey completion. So that was when the symptoms typically began, just short after the vaccine, but we're going on for a long, long time here. So the time from vaccination to symptom survey completion, the average time here was 595 days. Interquartile range, 50% lying between 417 and 661 days. This is a long time post-vaccine. And this is a quality of life survey here, this quality of life analogue scale looking at various parameters. And they found it was 50. So what this scale does, you would say 0 is terrible, 100 is good. So you can see a lot of these people aren't doing very well on quite a few quality of life parameters, which is pretty... it's very sad and terrible for the individuals. 5 most common symptoms, as we've said: exercise intolerance, 71%, exercise fatigue, 69%, numbness, 63%, brain fog, neuropathy, 63%. Now, this is perhaps, I think you could almost say, equally concerning, really. In the week before the survey was completed, people were asked to give their experiences, and the people who reported had experienced these at least once in the week before they filled out the questionnaire. Feeling uneasy, 93%, at least once in the week. Fearfulness, the anxiety that we're talking about, 82%. Overwhelmed by worries, 81%. Feeling of helplessness, 80%. Anxiety, 76%. Depression, 76%. Hopelessness, 72%. And of course, you can see that these percentages are so high that many people are suffering from more than one. And feelings of worthlessness, 49% experience those. And there are also concerns related to living situations, food security and accommodation. So we see that this post-vaccine syndrome is being reported by these participants to affect many aspects of life, these medical aspects, these psychological stroke psychiatric aspects, and their ability to just provide for themselves normally in the world. So I'll put those in the description. They're all listed there. All totally horrible features. So the people filling out these experience those at least once in the week. Now, symptom severity. When asked to quantify their symptoms, 0 from trivial to 100 unbearable, participants reported that the worst symptom was 80. So pretty bad, 8 out of 10 for severity on their worst days. Good days, bad days, but on the worst days, 80 out of 100. Severe, I would call that quite severe. Now, they've tried various interventions, these individuals. In fact, they reported a median of 20 interventions, 20 things that people have tried. So I think this talks about desperation, really. They've tried 20 different things to try and alleviate their symptoms, because there's no standard treatment. This is partly what the study wants to do. We need to standardise the treatment for individuals with post-vaccine syndrome. But anyway, let's look at some of the things that they had tried. Oral steroids, very powerful anti-inflammatory drugs. 48% had tried that. Gabapentin, which is usually used for peripheral nerve conditions, 25% had tried that. Low-dose naltrexone, 20% had tried that. Drug beginning with I, 44, 18% had tried that. Propranolol, beta blocker, 11%. Bronchodilators to dilate the respiratory passages, 11% had tried that. So it looks like they're people's... Now, of course, we are not saying, and the study is not saying, that any of these are efficacious. Not at all. No one is advising any treatments here. They're just simply reporting that this is what people have tried to relieve their symptoms. These are what people have reported that they have tried. This is part of the problem. We need a database for what is effective so that doctors can prescribe effectively. More than 500 additional treatments were reported by participants. Again, I think this is just showing desperation. People were trying many different things: limiting exercise or exertion, quitting alcohol or caffeine, hydration and increased salt intake, intermittent fasting. Again, no discussion that these are effective or ineffective. It's just reporting what people had tried. Now, the conclusion of the study. In this study, individuals who reported post-vaccine syndrome after COVID-19 vaccination had low health status. Low health status. Not what we want. Remember, the median age here was only 46. Was it 46? I'm pretty sure it was 46 was the median age. Anyway, yeah, I'm pretty sure it was 46. Yeah, 46. So we're dealing with relatively young people here much of the time with low health status. This is not the way it should be. The middle years of life should be, for the most part, healthy, for the most part, for most of us. High symptom burden. We're complaining a lot of symptoms. High psychological stress. Of course, if there's something wrong with you, and especially a chronic disease, that does lead to anxiety and depression. Or that could be an intrinsic part of the syndrome, that people get anxiety and depression. So it could be like a primary manifestation of the syndrome, or it could be secondary to all the other things that are going on. Either way, it's horrible and distressing for the individual. Despite trying many treatments, and then the paper says there's a need for continued investigation to understand and treat this condition. Absolutely there is. We agree absolutely, totally, completely with that. This needs to get into mainstream medicine. Now, finally, I haven't checked this out myself, but this is the way that the study was completed through Kindred. I think you can probably join this. I haven't tried it, but I think you can do it. Kindred is a community of patients working with researchers to power more useful, impactful progress. And they're the links there if you want to check that out. I'd probably be able to report your symptoms on there. Obvious questions is why hasn't this data been published by the bodies that are supposed to monitor this sort of thing? Yellow card system in the UK, VAERS in the United States. Why aren't we getting papers from the CDC and the health service in the UK? But these people at Yale are listening. And maybe we should just close with that. If someone is suffering from something, whether it's physical or psychological, listen to them. Refer them on to professionals as well, of course. But if someone says, look, tell you the truth, John, whatever your name is, I'm not feeling that good today. I'm feeling a bit anxious today. Then listen to that, because for someone to say that might require quite a bit of courage for them to say that. If someone's a bit depressed and they say, look, Joan, I'm a bit down today. It's probably taken a lot of courage for them to say that. And if you say something like, "Oh, don't worry, you'll be better soon," then that's kind of almost dismissing what they've said. If someone says that to you, take it on board and say, "Oh, really? Thank you for telling me. Tell me more if you'd like to." Listen to what people say. Doctors, nurses need to listen to what people say. Everyone needs to listen to what people say. The human experience is real. And we need to listen to each other's and take it seriously and believe people when they report their feelings. That's what a symptom is by definition. It's something the patient experiences, not a clinical sign that you can see, like a knee reflex. Symptom's something a patient reports. If a patient reports a symptom, believe it. Unless you've got very firm evidence that it's not true, then we need to believe it. And that's what this study is doing. It's listening to people. And one of the indictments of the healthcare professionals over the past few years is maybe not quite enough listening. But thank you for listening.